Hi, guys. Today we have Dr. Vera Borzova on the podcast. She's a pediatric anesthesiologist from Cleveland, Ohio. She received her medical degree from Camarillo State Medical Academy and has been practicing medicine for 20 years. Thank you so much for joining us today.
Thank you.
So, Dr. Borzova, I thought it would be helpful if we started off with your background. So, could you give us a brief overview of your education and your journey to becoming a doctor?
Well, first of all, my education started overseas. So my education started back in Russia. And the system in Russia is actually very different. So in Russia, at least at the time when I was graduating, we didn't have to go through the college. So typically you would graduate from the high school, and majority of the kids in Russia would graduate actually at 17. So at the 17, you have to make this life altering decisions and decide what you want to do with the rest of your life. So and then you go to medical school, and medical school typically it's like 6 years of medical school. And after that, you're doing your 1 or 2 years of residency. And after that, you're free to practice. Well, in my case, my journey wasn't completely straightforward. So I'm actually trying to get a little shot. Well, here's the thing. At the time when I was graduating from high school in Russia, so usually the choices for us was either engineer or teacher or doctor. So I kind of eliminated the first two, so that's kind of left with a doctor. So, but then it didn't quite work out. So because I decided to try it, and I tried it in a way which is kind of, again, unique to Russia. I decided to try to take the only available job in the hospital, which was like a cleaning and operating room. So I was literally working in the operating room, like cleaning, scrubbing the floor. I was 17, and just to make things worse, I actually was caught on fire one time, literally was burning, in the burn unit. And I decided, no, that's not for me. So I don't want to practice this kind of medicine. Also, it took me a couple of years. So I was trying to be this, and I'm trying to be that. And then eventually I decided to give it a second shot. And then I guess what made me decide the second time around is the fact that I've met some amazing people. I felt, sometimes you really need a good role models, and they kind of really can shape your future. So I felt that I've met the most amazing, interesting, sophisticated, intelligent people in the children's hospital, in the town of Novokuznet. And that sort of sealed the deal. So, and then I decided to go to medical school, went to medical school, graduated, worked a couple of years back in Russia, in my hometown. And then, well, my life kind of took a little bit unexpected turn. And I happened to meet my future husband and decided to immigrate to the United States. Over here, it was kind of a little bit of a cultural shock. It was different. It was the amount of information I had to digest very quickly seems enormous. But again, I had a good role model, including Dr. Olga Zilberstein, who was she did it before me. And she was a good example that it's actually very doable. And I decided to study. I studied, I took my SMLE. I think honestly, I've been so scared. I was so afraid that I wouldn't get a residency, that I studied so hard that I actually ended up to score pretty well, pure panic that I'll better study and better get to the residency. So I got my USMLE and I was accepted, which I felt was a phenomenal program. I did my pediatric residency at Wayne State University Children's Hospital. That's just a phenomenal place. You can learn just about anything and everything about pediatrics in that place. So I really, really loved it. But then I decided that I kind of want to narrow my focus, and eventually ended up being a pediatric anesthesiologist.
Wow, that's very interesting.
So why did you decide that pediatric anesthesiology was the route and what you really wanted to do for the rest of your career?
Mm-hmm. Well, I think there's two components to it. One is the pediatric and the second is anesthesiologist. Well, the pediatrics was kind of almost a given because that's like a unique aspect of the Russian system, Soviet system, I should say. And I cannot speak for the current system, it might have changed. But at the time, like when you decide to go to medical school, right on entrance, you have to decide whether you want to be a pediatrician or internist. And imagine majority of the kids doing it like at 17. I did it at 19. So I committed myself again because I was like, had a short experience in the children's hospital in Siberia, Novokuznetsk, and I really like those doctors. So I decided that I want to be a pediatrician. But when I did my residency here, I was attracted to more acute care settings. And my first choice actually was in emergency medicine. I really, really loved emergency medicine. I kind of like this fast pace, you kind of have to think quick. I like the fact that there's like, you have to do some procedures. And it's almost like that I really, really wanted to do emergency medicine. The only problem was that I absolutely could not work shifts. So like the fact that you have to, one day you work like morning, the other day you work evening, the other day you work like they work nights, like for me, just like totally destroyed my circadian rhythm. And I quickly realized after doing like a couple of rotations, which I absolutely loved. Otherwise, I decided, nope, I probably cannot do it for the rest of my life. But in anesthesia, I did a rotation in anesthesia, and it's kind of similar. There is a lot of similarities because you have to think quickly on your feet. It is heavily, obviously, procedure-oriented specialty, so you get immediate gratification of doing something and seeing the results. You can focus on a couple of patients at a time. In other words, you don't have a ward of like 20, 30 patients, right? You have to take care of. And you kind of can give all of you, like yourself, to these few patients, do them well, and move to the next one. So I guess it fitted my personality. It's like enough stimulation and challenge, intellectual challenge in terms of the technical skills. And so that turned out to be a very good career choice for me.
Mm-hmm. So with pediatric anesthesiology, what are some of the like more specific differences from just general anesthesiologists treating patients?
Well, the one most important is actually the cuteness factor, okay? So our patients are very, very cute. And that's kind of like, that's a fun and a nice like part of my job, because sometimes I actually carry my patients in the room. And as I'm carrying my patients, like everybody is like, what a cute baby, right? So, and it's just like kind of fun to work with children. The other thing I would say, I like an optimistic nature of kids. I think most of the kids, they're sort of optimistic by nature. I'll give you an example. Like, will the kid break a leg, say, and the adult breaks the leg, right? So, well, the adults, will they have to go through the physical therapy? They think about how difficult it's going to be for them. So there's a whole lot of like spectrum of some mental kind of constructs about it. And you have a kid, the kid just wants to play. So the kid bounces back and is already like running around and playing. So this like innate, like optimistic nature of children's kind of like appeals to me. And then also there is, of course, unique challenges. For one, it's like a little bit of a cliche, but it is very true that we have to treat the whole family. So the child does not live in the isolation. So we certainly have to make sure that everybody is on board. And the other thing, I mean, it does provide additional challenges, technical challenges. I can tell you that the smallest patients I took care of was exactly 1 pound, 460 grams. So when you imagine this tiny little piece, right? So like this little tiny human being, and you imagine yourself, well, it's a very different set of challenges, technical challenges, which is also kind of interesting and appealing. And the other thing, actually, what I think I like about pediatric anesthesia, a lot of adult anesthesiologists are super, super subspecialized. But it's not so much in peds. In other words, I am, as a pediatric anesthesiologist, I can take care of some cardiac patients, not necessarily putting them on bypass, but nonetheless. And I can take care of the thoracic patients, like for the abdominal surgery, for chest surgery, for the brain surgery, for the broken legs. So that kind of makes my day more interesting because I'm not doing the same thing again and again and again. right?
If you had to go back and kind of choose a different career, could you see yourself having a different specialty, or do you think you found your passion in anesthesiology?
Well, consider that it took me a couple of years before I went to medical school. And then I did like a residency in Russia and residency here and fellowship and everything. So that'd be a long like way around, like to do something else. But I have to say, looking back, I think it was all worth it. And I think for me personally, I found my niche. I found the area which I absolutely love. And I wouldn't do it anyway. I wouldn't do it differently.
That's great to
Definitely
hear.
not.
So as an anesthesiologist, before you were talking about how sometimes you're on your feet a lot, or like you're on your feet and have to think fast. Is there any like
Mhm.
incidents that stand out of where there was a complication or something during surgery where you had to make changes that you think would be beneficial for us to hear, or just that you think is a great accomplishment of yours among many
Well,
others?
we all hoping, like our hope every time to have the most routine and the most uneventful surgery. Okay, so that's our hope. So boring is good when it comes to anesthesia. As a matter of fact, the anesthesiologists often compared to the pilots, the pilots, like they very obviously intense on the takeoff and landing, and then you sort of like the cruise control, and that's what you're hoping for, that's how your day will go. So kind of like the autopilot. But no, of course, just like in the pilot, if something happens, right? Something happens, like, okay, let me think, I'll think about it, and like tomorrow morning, I'll come with the answer, right? So that doesn't work this way. So you really have to figure out things quickly. So yeah, no, of course. I mean, it happens, like for us, it happens with certain regularity in the operating room, but something like happens. And the truth of the matter, you have several variables. Like the one variable is like, well, your patient, but keep in mind, your patient is not talking to you, your patient is not communicating, right? So there is a limited amount of information you can get from the patient, although the information is critical. Then you have your anesthesia machine, which presents its own set of problems, the breathing machine, right? So what I'm trying to say, there could be problems with the patient, there could be problems with the machine, there could be the problems with the medication that you just administered to the patient, right? There could be a problem on the other side of the surgical drape when the surgeon is doing something, right? So it's perhaps something happened during surgical procedure, and now you on your end see the results of it. So you kind of have to think very, very quickly, and you have to sort it out and kind of have a good algorithm in your head to think, how do you narrow it down between multiple variables which are there? So what it is and what's the best way to treat, and you kind of constantly reassessing it, because again, you do something to the patient's not going to tell you like feeling better or whatever, right? So you have to figure out on your own. So you go by certain criteria, but it's continuous loop. So you try to diagnose the problem, you intervene, you hope you're doing the correct things, and then you look for the reassurance. But you also don't want to end up in the track, which you think you know what the problem is, and totally sidetracked and gets fixated and totally misses the problem. So no, I mean, it's like it can be quite challenging and stimulating intellectually. Although I didn't give you like an exact example, because I don't know if it would be a good example, not without providing any technical details, but just kind of like in terms how you think about things. You can understand at least some degree of the complexity.
Yeah, that was definitely a good analogy to the pilot, how you want it to be routine, but sometimes stuff goes wrong.
So talking about your overall experiences as a doctor, as an anesthesiologist, what would you say your favorite part of your career is? Like your everyday, just your favorite thing in general.
Well, my favorite thing, I actually do like to interact with patients. I really enjoy it. I do interact with I'm actually a pretty introverted person, so I'm not classical, like typical, like persons, like people's person, but I do enjoy that component of my job. I also enjoy my colleagues very much. I think I'm extremely blessed because we have a wonderful, extremely collegial, kind, nice group of people who's kind of became my work family. So I enjoy my interactions with them. And as cliche it might sound, I actually do like to help people. So because like you do something and you get somebody through the surgery, through the anesthesia, and it's sort of uneventful, and it's like it does provide you with a sense gratification. Now, a lot of what we're doing is actually not obvious to the eye. So like for the patient just goes to sleep and wakes up, and they don't really know not much what's happening. So it's kind of for them, it might not be that big of a deal in terms of the details, but for me, it's important. So I want to make sure that my patient has a very good experience, went to sleep smoothly, went through the surgery uneventfully, wake up smoothly and doesn't have any postoperative complications. And if I can accomplish it, so that actually does give me a sense of like, well, overall sense of accomplishment. So I really truly do like it, that part of it.
So I guess on the other end of the spectrum, what would you say is like your least favorite thing or the worst part about being a doctor?
Well, that is such a big topic, and I just don't know to what extent I want to go into it. But I think, it's kind of a little bit broader. I would probably say it's a little bit broader. So what I came to understand when I first initially was to the medicine, it was like an intellectual component of it. It's almost like, to me, being a medical doctor is kind of like a detective. You try to detect the problem, figure it out, and that's yes, aha moment. I know what it is. Well, now everything should be easy. You sort of like, I can treat it. But as I go getting sort of like more seasoned in my profession and in terms of my just even as a human being, as a doctor, I think we're kind of missing the healing component of the life of the medicine. And it's not always the same. So the healing is much broader topic than it just administering during the procedures, like giving medication. And I think, unfortunately, we're kind of a little bit missing it. The other thing, I think unfortunately, we created I mean, you probably heard about it by now, like it's like people talking about it, and I think with a good reason. So what we call a health system is really truly became a sick system. So we kind of taught ourselves how to take care of the life of sick people. But I think it's time for us to look around, and we really have to teach ourselves about health, because quite frankly, I'm not interested in being sick. I'm interested in being healthy. You probably, well, I mean, you're too young. So for you, it's like a given, you're just young and healthy. But I think for a lot of people, and doctor may or may not be your first actually choice when it comes to health. You might go to, you may be like your trainer, like in the like gym or whatever, right? Or you might go like talk about the exercises, or maybe somebody has a dietitian or somebody else like, but it's just unfortunate because I think the doctor should be the person who actually teaches and knows something about the health before we step to the disease. And that's, I think that's for me, it's a bigger frustrating part. So the other thing what I realized, working, getting experience back in Russia and here in the United States, we're doing an absolutely phenomenal job when it comes to the acute care. So whether it's a broken bones and the heart attack, whatever you name it, if we can provide a procedure, do surgery, nobody else in the world can do better. But when it comes to the chronic conditions, unfortunately, whatever we are doing doesn't kind of translate with the good results. So I think it's time to us to rethink what we think of health and not health and sickness, and how can we achieve the ultimate health, but not kind of pour billions and billions of dollars into in just kind of just barely getting by, and so people are not dying, whatever.
Yeah, you definitely see that. I feel like there's definitely not an emphasis on like preventative medicine, which is essentially just health and maintaining a healthy lifestyle. And that is really what truly leads to a lot of these chronic diseases that unfortunately a lot of people have to deal with.
Right.
Yeah, no, that is a very interesting perspective, because you don't hear a lot of doctors talking about it, but staying healthy and being healthy and living a healthy lifestyle is very important and something that is not we don't have an emphasis on.
Yeah, no, I mean, well, part of it is just like how the system is designed. So, and the system is designed as a business, and unfortunately, like the best business comes from the chronically sick patients. So, if you're very healthy, it's like it's not very profitable. Unfortunately, it shouldn't be like this, but the reality is that. And of course, if you are dead, you're not particularly profitable. But if you're kind of in between, so that's a good sort of market. And I think from the humanistic perspective, that is just wrong. I think still majority of the people go into the medicine not because they just want to make a good amount of money, but because they actually have those altruistic ideas and they do want to help people.
Mhm. All right. Well, thank you so much, Dr. Borzova, for coming in and talking with us today. We really do appreciate your time, and we learned definitely a lot today.
My pleasure. Absolutely my pleasure.
Thank
Thank
you
you
so
very
much.
much again. Good evening. Bye-bye.
Take care. Bye.
Bye.